everyone, my name is Norida Mahidin. It's ID 2023437192. So today I would like to talk about medicinal plants. So before I start further, I will tell you about the three objectives of our topic today. So the first one is to determine the signs of allergic reactions of the medicinal plant. The second one is to identify the cultural and ethical consideration be followed. And the last one is to study the issues that might occur in medicinal. So, what is medicinal plant? Medicinal plant also can be called as medicinal herbs. It have been discovered and used in traditional plants since prehistoric times. So, plants synthesize hundreds of chemical compounds for various functions, including defense and protections against fungi, bacteria, insects, disease, and also herbivorous mammals. What are the examples of medicinal plants? I will tell you the 5 examples of medicinal plants, but there are more of medicinal plants in this world. So, 5 of the examples that I will tell you is garlic. What is the functions of garlic? Garlic can be used to prevent infection, lower blood pressure, reduce fever, and also to treat liver disease. And the next one is ginger. Ginger can be used to remedy common ailments such as nausea, pain, and also vomiting. And followed by the third plant, and which is chamomile. Chamomile can be used to reduce anxiety. And the fourth is lavender. Lavender is the common plant. I think lavender is used to help to sleep, relieve pain, improve memory, and also to boost up your mood, uplift your mood. And the last one is ginseng. Ginseng, what is the function of ginseng? It can be used to improve circulation, boost immunity, and to protect against certain types of cancer. I think that's all from me. Thank you.
Next, we will talk about issues of medicinal herbs. First, drug interaction. Herbal medicine interactions with pharmaceutical drugs happen when the active ingredients in the herbs affect how the drugs are absorbed, metabolized, distributed, or eliminated from the body. The effectiveness of safety of the prescribed medication or the herbal remedy may alter as a result of this interaction. Next is metabolic interaction. The liver cytochrome P450 CYP enzymes, which are in charge of metabolizing medications, are involved in numerous drug interactions. Certain herbs can cause or inhibit these enzymes, which can change how drugs are metabolized. For example, St. John's wort induces CYP3A4 can speed up the breakdown of different medication, decreasing their efficacy. Another examples that we have is garlic and ginseng. Garlic may enhance the anticoagulant effects of drugs like warfarin, leading to an increased risk of bleeding. It can also interact with medications used to treat HIV, while ginseng can interact with anticoagulant and antiplatelet medications, increasing the risk of bleeding. It may also affect blood sugar levels and interact with diabetes medication.
Alright, so let's talk about allergic reactions. All plants have the potential to trigger allergies whether they are inside or outside. It is dependent on the person, their particular genetic profile, and their lifestyle choice. Various medicinal herbs have pharmacological effects that cause allergic reactions. A medicinal plant allergy occurs when certain substance present in therapeutic plants cause adverse reaction in an individual immune system. Alright, so let me give you some example of the plants that cause allergic reactions. The first one is echinacea, and the reactions are anaphylaxis, acute asthma attacks, hives, swelling, stinging of the tongue, shivering, fever, and muscle weakness. And the second one is St. John's wort. The reactions are hive, difficult breathing, swelling on the face, lips, tongue, or throat. Please avoid exposure to sunlight because it is leading to skin rash. And the next one is chamomile. And the reactions are hive, itching sensation in the mouth, swelling, and anaphylaxis. And the last one is aloe vera. The reactions are rash, throat tightness, difficulty breathing, and chest pain.
is Adriana. Now let's talk about the culture and the ethical consideration. There are 5 cultural considerations that we need to focus on before the tree is taken. First of all, the traditional knowledge. Plants have long been used as a medicine in many different civilizations. Knowing the traditional wisdom that has been passed down through the years is frequently crucial in comprehending the medical qualities of particular plants. The second one is culture diversity. Certain ceremonies, ritual, or cultural tradition relate to the use of plant for medical purpose may exist in many civilizations. Comprehending and honoring this custom is crucial for moral and culturally aware interaction. The next one is transmission of knowledge. Acknowledge that the cultural belief and custom of the medicinal plant can differ greatly between groups. The assessment and the application of medicinal plants should take into the account the cultural context, since what is deemed medicinal in one society may not be in another. Okay, the other one is integration with traditional medicine. Medicinal plants are an essential component of traditional medical system in several cultures. Acknowledging and incorporating traditional medicine into medical procedure can enhance patient outcome and foster community trust. The last one is culture sensitivity. The use of medicinal plants should be approached with cultural awareness by researchers, respecting cultural custom, values, and taboos around the usage of plants is a part of this. Guys, now let's move to the ethical consideration for choosing medicinal plants. There's 4 ethical considerations that we need to focus on for choosing medicinal plants. First of all is informed consent. When it comes to research with medicinal plants, informed consent means that study participants have to fully inform about the purpose of the study. The second one is only access relevant plants. Okay, for this statement is keep assessment focused on the factor pertinent to the participants in the program and its objective, and refrain from utilizing high-risk group as a blank slate for general inquiries. This keeps people from being used as a test subject for unrelated research into the medicinal plant project, and make assessment more in line with the actual requirement and goals of the program and its users. The third one of the ethical consideration is confidentiality. Regarding medicinal plants, confidentiality means that any personal identifiable information is kept under the lock and key, available only to individuals who are authorized to work on the program. The last one is do not harm. It is important to take into the account the possible drawback of utilizing medicinal herbs, which can include both psychology and physical effect.
Hi, now we move to the next part, which is the recommendation for the issue in this medical plan. Firstly, we need to alert before taking any product. Make sure we consult with a doctor for a proper diagnosis. Secondly, people with autoimmune disease should not take echinacea because they are concerned that the plant echinacea may reduce the effectiveness of the drug that suppresses the immune system in the body of the patient. Next, we must not use herbs such as John wood to treat severe depression because it can make the depression become more worse. Next, chamomile may make asthma patient worse, so asthma patients should not take it. And last but not least, high usage or dose of aloe vera can cause kidney damage. That's all for the recommendation part. Now we move to the next part, which is conclusion. So now we are in the last part of the video, which is the conclusion part. So we can conclude that medical plant can be good alternative for many disease and condition. Next, medical plant also can be defined as plants that have therapeutic properties that provide benefits and side effects to humans. And lastly, it is important for users to be aware and avoid taking medicine that cause any adverse reaction for themselves. So that's the end of the video, and that's all from our group. Thank you.